Flu season has begun in Canada. It's already caused outbreaks in Japan and the UK. And it's hit earlier than previous years, and it's more intense. Dr. Donald Vinh is an infectious disease specialist at the MUHC. Hi, Don.
Hi, Mitsumi.
So, Don, the fact that the flu has begun earlier and is more intense, what does that tell you about this virus?
Yeah, you're right, Mitsumi. Flu activity is rising much earlier than usual, and in many regions, test positivity is already over 10%. And there's two big reasons behind this surge, right? First, vaccination rates are low. We know the flu vaccine doesn't just reduce your risk of severe illness, it also lowers how contagious you are if you do get infected. But that protection only works if people actually get the shot. When vaccination rates sit between 30 to 60%, the virus sees little resistance. And second, we're dealing with a new, fast spreading H3N2 strain that's now dominant across the northern hemisphere. H3N2 is, by the way, is already a concern because it tends to cause more severe illness. So seeing a new strain is quite worrisome. So this combination of low flu immunity and a potentially more transmissible flu strain sets the stage for a surge that can move through communities like a hot knife through butter.
Okay, so it's already caused outbreaks in Japan and the UK. What can we expect here in Canada? And what's the current status of the flu here in Quebec?
Yeah. So here in Canada, the flu season is already clearly ramping up. The latest Public Health Agency of Canada data show our test positivity rates nationwide jumped from about 1.9% to about 5.5% in just 2 weeks. And just so folks know, once you hit 5%, Canada is officially in a flu epidemic. So we're there now. And what we're seeing are rising cases across all age groups, 25% in children and teenagers, 35% in adults up to the age of 64, 40% in adults 65 and older. And these are not just the cases. Importantly, hospitalizations are also increasing in children and in adults over 45. So that's concerning. In Quebec, we're seeing the exact same trend. We're seeing a test positivity rate of about 5.5%. But what's interesting in Quebec, being a little bit different from the rest of Canada, is that Quebec so far has mostly seen H1N1 rather than this H3N2. But it's still very early in the season. If this H3N2 strain causes more severe illness elsewhere and starts circulating rapidly in Quebec, we can start to see a sharp rise in hospitalizations, and that can lead to a lot of stress on their healthcare system.
Okay, so you've mentioned the H3N2 and the H1N1, but there's also talk of this H5N5, bird flu. Why is this strain an issue?
So the H5N5 is a concern. So there is H1N1 is circulating, H3N2 is circulating. This new bird flu strain called H5N5 that infected a human for the first time ever in Washington State recently. The issue with that is that person died. So now we have these three strains that are circulating. H5N5, by the way, is not the same as the previous H5N1 bird flu that we talked about, where millions of wild birds and poultry and U.S. dairy cows were affected. H5N5 is different, and it's also unexpected. So the real concern are these unknowns. We don't know where H5N5 came from, and when multiple flu strains are circulating all at the same time, there's a risk that they could co-infect the same person or animal. When that happens, the viruses can swap genetic material, and that could potentially lead to a more dangerous super flu strain.
We keep hearing how the current flu vaccine is not a good match. So getting this current flu vaccine, how is this going to help us?
So actually, there's some encouraging news on this front. So even though this new H3N2 strain, what we call subclade K, is circulating and it's drifted away from the strain that's in the vaccine, early data from the UK shows that the vaccine that we're using still offers meaningful protection. Children are about 70 to 75% less likely to end up in hospital if vaccinated, and adults are roughly 30 to 40% less likely. This is still early data, obviously, but it's encouraging. It means that even though the match between the vaccine strain and the circulating strain isn't perfect, the vaccine still works very well at preventing serious illness, hospitalizations, and deaths. So any person who is at high risk, whether they're an older adult, a person with chronic illness, pregnant women, they need to get vaccinated as soon as possible if they haven't already.
And very quickly, Don, other than being vaccinated, is there anything else people can do?
Well, I don't want to say the M word, but the mask is very important. If you are in crowded areas, especially in areas that have poor ventilation, we need to reconsider the mask. If you are sick and you're going to potentially expose other people, wear a mask if you can't stay home. And we also have to practice good hygiene, like like covering your cough and sneeze, washing your hands, and disinfecting surfaces. But really, the vaccine is a key component of this preventive strategy.
Okay. Thank you very much, Don.
Thanks for tuning.